I have a request. Please think about a day that's important to you, but a day that you cannot remember. It is the day you were born. What stories have you heard about your birth? Did your mother take a taxi to the hospital? Was it a long and difficult labor, or a birth so quick it took everyone by surprise? I recently received in the mail from my cousin the telegram his family had gotten when I was born, and it brought to mind the joy and pleasure and excitement that a new baby brings to a family. But perhaps you have only a date and location of your birth. Around the world, many people have no written record of their birth. But we all know that we developed inside a woman's body, and that through the birth canal or a surgical incision, we emerge to life as a distinct person. For me, the most exciting day of kindergarten was the day that the baby chicks hatched in the incubator. I was so excited I could hardly sleep the night before. And when I heard about the career of midwifery, I knew it was the most exciting job I could imagine. And it has been my life's work. I have attended thousands of births, but each birth is unique. Midwifery is very satisfying work, but it is hard work. It is staying up night after night, helping mothers who are in pain and struggling, and keeping in mind the welfare of the baby when you have only the rate of its heartbeat to evaluate it. Then there is the work of the clinic. Prenatal care, sharing the joys and discomforts of pregnancy, but also hearing the hard things in life that women face. Also managing contraceptive methods, testing for sexually transmitted infections, and screening for breast and cervical cancer. It involves calling women to tell them that their test is positive for a sexually transmitted infection, or that their screening for cancer is positive and that they will need more testing. But always it is listening, hearing about sexual and family violence, hearing about relationships and heartbreak, and hoping when there is sorrow to bring healing. But recent data has indicated a troubling trend of more women dying in childbirth. And the U.S. is alone in this trend. Other developing countries had lower rates of maternal mortality and have been able to decrease even these low rates. But in the United States, the rate has increased rather dramatically. The promise of modern medicine was to make childbirth and pregnancy safer. Blood banks, antibiotics, safer surgery have helped to reduce the number of women dying. In 1951, 1 in 1,000 women per every 1,000 live births died. By 1987, about 9 women per 100,000 live births died. So it was a decrease, an exponential decrease. But in 1990, the rate started to rise very gradually, and after 2000, it rose dramatically to reach 26 women per 100,000 live births. We are not sure why this happened. Only 33 states have maternal mortality review boards, and among these states, the results are not standardized, so it's difficult to compare from state to state what the causes would be. Also, in the United States, when a maternal death occurs, there's very little support for the healthcare providers who were present. And in fact, they may be blamed for wrongdoing or even sued. So it's difficult to collect honest data on what happened. In the United Kingdom, the National Health Service has a review process where providers can tell honestly what happened, so that if there are things that can be changed, they become known, and then it can be prevented in the future. In comparing the U.S. maternity care to other developed countries, it is clear that the U.S. does not have a system of maternity care. When a woman suspects she is pregnant, she has to find a doctor, a clinic, or a midwife and get an appointment. There are many barriers to care. There may be insurance issues, payment issues, or it may just be difficult to get an appointment in a timely manner. Also, in developed countries with such low rates of maternal mortality, their access to maternity care is readily available, and midwives are integrated into the healthcare system. In the U.S., midwives are mostly relegated to caring for low-risk women, and they do face legal barriers to practice in some states, and also barriers from hospitals. The World Health Organization recognizes midwifery as the gold standard for maternity care. The respected British journal, The Lancet, recently had a whole issue on midwifery. The International Congress of Midwives has standards and competencies for midwives, and the American College of Nurse Midwives also has competencies and standards, but also examinations that a midwife must take to be certified, and they must recertify every 5 years. Looking at the data on midwifery care, for low-risk women, doctors and midwives have the same outcomes, the same number of maternal and fetal deaths and serious complications, although midwives have use fewer medical interventions during pregnancy. But it is for the high-risk women where midwifery care makes a big difference in improving outcomes. This is not because midwives know more than doctors, or that midwives are somehow better than doctors, but when midwives take care of high-risk patients, they're practicing in a team. They're collaborating with family practice doctors, obstetrician, gynecologists, perinatologists, pediatricians, but also mental health providers, social workers, dietitians, physical therapists, and other healthcare providers. And when the midwives can continue seeing the high-risk women, they can evaluate, make sure the woman does have access to the specialist, and that they understand the care they are getting, and that they are able to cooperate with it. The work of the midwife starts with listening to the woman and her family, evaluating vital signs and the physical exam, and ordering blood tests and imaging tests. When the results of the tests are back, they share that information with the woman and make a plan with the woman on steps to take to promote health in pregnancy. Midwives also care for women by providing contraception and testing for sexually transmitted infections and screening for cancer. If every woman in America had access to midwifery care, and every midwife in America had access to a comprehensive, respectful referral system, women's lives would be saved, and complications could be avoided. Midwifery education does need to be expanded in two fields. Midwives need to be able to respond to sexual violence. Sexual violence negatively impacts a person's health. It can lead to an increase in chronic disease and a decrease a person's sense of well-being. And since 1/3 of women have experienced sexual violence, this is a tremendous toll on the nation's health care. Midwives are already dealing with many personal things in women's lives, and midwives, if they need to be comfortable in screening for sexual violence, but also beginning the healing by helping the woman understand how common it is, and to help them access the modality of treatment that will be most useful for them. Midwives also need more training in collecting data and understanding how data is analyzed and interpreted, so that midwifery care can continue to be safer and safer, and when new innovations in maternity care are introduced, we can see whether they truly bring better outcomes or not. I'm asking for your support for resources to provide education so there can be enough midwives that every woman has access to a midwife. Together we can save lives. Thank you.